suffered low back pain, you're going to want to hear this segment. Stacy Irvine now from Total Life Science. Hi, Stace. How are you?
I'm good. How are you?
I'm well. Now, you and I both know about the pain that I've gone through with my low back, which is finally starting to get better, and I know backs take a long time, but a lot of Canadians suffer low back pain, like a lot.
A lot. 85% of us will experience low back pain at some point in our life. It's one of the highest incidents of disability, so it affects all of us. It affects employers, it affects insurers. Low back pain is such a huge issue, and it's getting bigger because we sit more, we're a little more deconditioned. We like to sit for 8 hours in front of our computers and then run out and try to do some activity, and those are all kind of risk factors for low back pain. Unfortunately, as you and I both know, I've had it, you've had it, and it really does touch you. And once you've had it, you have to really work on keeping your core strong. So it's important to be aware of all these little tips. Hopefully you can prevent it, but if not, at least how do you manage it properly? Okay, good. So Debbie's going to come in here as our model. I'm sure wearing shoes like this doesn't help my low back pain either, but it is getting better. Debbie, it's good to see you. It depends how long you wear them. Okay, so what we're going to talk about is what do you do when you have low back pain? Because one of the issues is it's extremely painful. Debbie's had it too. And guess where a lot of people end up? Where? Emerge. Okay, and that's a problem. That's a problem for our healthcare system because in Emerge, it's going to be difficult. You're going to wait for a really long time. You might get some imaging done, but you're not actually usually going to get the cause of what's going on with your low back. So we want to encourage you to come to someone who's an expert in musculoskeletal injuries, so chiropractor, physio. I work as a chiropractor, so we want to talk about, you know, who do you go see? Who's your first person? You should try to build that network almost ahead of time before you have the issue, so you can make a phone call, go and see them right away. So then what happens when you get there? So you're going to have to go through a few sort of actions so that the chiropractor can know exactly where you're experiencing that pain, because that's what they had to do with me. Yeah, that's what they did with you. And figure out if it was about the slip disc or if this was something completely different. Exactly. So what you're going to do, you're going to come in, you're going to fill out some paperwork, we're going to go through your history. So if Debbie was a patient of mine, my first thing would be, we'd come in, she'd sit down, I'd do a complete history with her. I want to check her family history, I want to check her activity history. We need to get to the bottom of why is this happening. Once we've done the history, we're going to start into the physical. So the physical would be things like, I would have Debbie stand. I'm going to look at her posture. Posture is very important for low back pain. Did everyone just do this in the audience? Because that's what happens to me every time someone mentions posture. I have lousy posture. Well, we all sit a lot. That's part of the problem. So we're looking at the natural curves in the spine. I'm looking for things to make sure everything is even, make sure everything looks balanced. I'm checking her from all angles to see. If someone's coming in with a back spasm, I might see one side elevated because they're in a full back spasm. Then I'm going to get her to move. So just come down to touch your toes. So now I'm looking at Debbie's range of motion around her hips. I'm looking to see how much flexibility she has through her low back. I'm looking to see what's tight, so we can see here in Debbie, she's a little tight there because it's not opening up completely, it's holding in together, which makes sense because she has a history of this, and also she just ran in a big track meet, which she did awesome in. Wow, good for you, Debbie. That is awesome. So I check some other ranges of motion. I'd get her to lift one foot up. This is another common test that we do. So this is very important. I'm seeing, do her glutes fire? Does that hurt at all, Debbie, when you do that?
No, it doesn't hurt.
Yeah. Okay, but it takes a little bit of...
Takes a little effort through the legs. Yes.
Okay. One of the most common things that happens with low back pain is we stop activating our glutes. So I'm poking you in your glutes. Try the other side. And can everyone activate their glutes right now, please? I'm actually doing it. Glute contraction. We all are. It's really good to get into the habit of firing them off, because if you don't, then all the stress comes into your low back, and that will lead to low back pain. So glute firing, glute strength is so crucial to preventing low back pain. And guess where we sit all day? When we're sitting on your glutes. Come have a seat up here, Debbie. So then once I've checked all that, I've looked at her ranges, I've seen how she's moving, I'm going to do a quick scan. I'm going to test her sensory reaction in her lower body. I'm going to check her reflexes, and then I'm going to check some of her strength, because what I'm wondering is, does her low back pain actually inhibit her motor function of her lower legs? Do we have any kind of really big issues going on? So I'd scan through all that, then I'd have her lay down on the bed.
And I'm going to check some more things. So I'm going to get Debbie to lift her leg up straight. Yeah. And I'm going to ask her if she has pain in that motion. Yeah. So a lot of this is me communicating with her. We're not doing that today because we're explaining it, but when you are a patient, I want you to always have the confidence to say what's going on. The more information I have as a practitioner, the better your treatment's going to be. Right. The more information I'm getting from you, this hurts, this feels tight, this feels a little strange, I feel weak on that side. Those are all excellent words that we need because we're trying to sort out what this situation is, okay?
So don't just feel the pain. If you're lifting her legs and she feels pain, she needs to communicate that to you.
Always communicate that. Then finally, I'm kind of doing passive ranges of motion. Again, I'm checking to see what's moving well, what's not moving well. I go through her hips. I would go all the way up and down her body. We want to get to the cause.
Yes.
Okay?
So you can fix it.
So we can
work on a plan to get it better.
That's the key. So once we finish this, I explain all this to my patient. Yes. Debbie, I'd say, you know, this is what I think's going on. How do you feel about that? Do you have any questions? Then you leave consent. So Debbie says to me, yes, I'm okay with it. I'm okay with treatment. And then we start the treatment plan. I check in with her a few times. This is not a lifelong event. Right. This is a few treatments where I get you pain-free, and then we go from there. Okay.
Good stuff. So that is a really good comprehensive guide to what will happen when you go in with your low back pain that so many of us suffer. Yeah. Thank you, Debbie, and thank you, Stace, for that. Well, March break has come and gone, and while some of you were hopefully lucky enough to go on a fun getaway with the family, we know that many more of you made the most of your time at home with the kids. So this week's hashtag Cityline Reel Challenge, we want to see your real March break activities. If they were sitting in front of an iPad all day long for 17 hours, show us. I'm not going to judge you. Post a pic from your March break on your social media accounts. Use the hashtag CityLineReel.